We're ready on our end. All right, good. Afternoon, everyone. Perfect. Good. All right, stand by, please. It's 11 minutes past 5 o'clock, this final day of February 28, 2021. Good afternoon and welcome to the Office of the Prime Minister right here in the Media Center in Kingston, Jamaica. My name is Naomi Francis. Today, the Prime Minister, the Most Honorable Andrew Holness, will update the nation on several matters, including COVID-19. The Prime Minister is joined by the Honorable Dr. Horace Chang, the Deputy Prime Minister and Minister of National Security. The Honorable Christopher Tufton, the Minister of Health and Wellness. Senator, the Honorable Kamina Johnson-Smith, the Minister of Foreign Affairs and Foreign Trade. The Honorable Favour Williams, Minister of Education, Youth and Information. The Honorable Robert Morgan, the Minister of State in the Ministry of Youth, Education and Information. Dunstan Bryan, the Permanent Secretary in the Ministry of Health and Wellness, along with the country's Chief Medical Officer, Dr. Jacqueline Mbisesa Mackenzie. Also with us this afternoon, Major General Anthony Anderson, the Commissioner of Police, along with Mr. Joseph Shukair, the Managing Director of SCJ. May I now invite the Prime Minister, the Most Honourable Andrew Holness, to address us.
Thank you, Naomi. Good afternoon, everyone. Thank you for joining this COVID-19 press conference. As you would be aware, the current disaster risk management order expires today. Let me start by giving an update on the current statistics and then go into the measures going forward. You will notice that I started off with my mask, and I cannot overemphasize all Jamaicans should be wearing their mask. I will take my mask off only for the convenience of the press conference so that I can be heard clearly. Now, as posted earlier today, the report for yesterday showed that we had 446 positive cases out of 4,704 samples tested. The samples tested included all reported PCR tests and public and private antigen tests, meaning persons who would have taken these tests either in the public system or would have gone to a private service provider for the tests. However, for decision-making purposes, we use the corrected positivity rate, which includes all PCR tests and antigen tests done where the negative antigen tests have been confirmed as true negatives by the PCR test. Now, I know that sounds a little bit complicated. The CMO, I'm certain, will explain that, but it is important that that be placed in the public record. The corrected positivity rate using this metric is therefore 28.8%. It is concerning that 1,881 persons who contracted COVID-19 in Jamaica did so over the past 7 days. Based on yesterday cumulative numbers, Jamaica recorded 23,263 cumulative cases of COVID-19, and unfortunately, 422 persons have died due to the pandemic, which represents a case fatality rate of approximately 1.8%. This is compared with the global rate of about 2.2%. I offer my sincere condolences to all who have lost loved ones due to this terrible disease. We have had 13,410 persons who have recovered, and therefore our recovery rate is now 57.6%. The number of active cases, that is the number of persons who still have the virus, is 9,209. However, the most worrying statistic is the increase in hospitalization across the island. The strategy of the government has always been to protect lives and livelihoods. It is a delicate balance. We have utilized two triggers for action. One, we act when we see an increase in numbers which tend towards an inflection point representing a spike. And we have never had to use this trigger, but we now have to use it, which is, for the first time, we're seeing the number of symptomatic persons requiring hospital care approximating the number of beds dedicated for COVID-19 treatment in our health system. This is a critical trigger. The Ministry of Health and Wellness will provide more details on what we have been doing to increase bed capacity, but that constraint, meaning space and human resources, those are binding constraints and cannot be increased in the short term. Like you, I am very much concerned when we see images of persons waiting with oxygen tanks in the hallways of hospital wards. It is not a good sight. It is important that we process these images because, unfortunately, too many of our brothers and sisters are beginning to take the COVID-19 pandemic for granted. Too many of them feel it is not a personal threat to them or their loved ones. This reminds us that the threat is real. Therefore, while we have managed to keep the case fatality rate below 2%, once the capacity of the health system becomes threatened, we could see a spike not only in the numbers infected, but also in those dying from the disease. This is therefore the critical fulcrum on which balance is maintained. And as it is now, we have to shift our policy efforts to ensuring that we can preserve every Jamaican's life. And that is the basis on which we come to you this afternoon. So, ladies and gentlemen, let me invite the CMO to come and give us some more details. But while she's making her way, you will recall in our previous press conferences, we would have pointed out what our reproductive rate was. The last statistic I have received tells me that our reproductive rate is 1.3, which means, and CMO, you will correct me quickly if I go off track, that means one Jamaican who is infected could potentially infect 1.3 other Jamaicans. You will understand that there is no 0.3 Jamaican. There is a full Jamaican. But from a statistical point of view, that is the rate at which the infection will spread. Measures such as the gathering rules limit how the spread can happen. So if you're in a group of 10, it is less likely that you will be as infective as if you're in a group of 20. So that is why we limit the rate. But I am not the health expert here, so I invite our hard-working CMO to come and give us some more details. CMO?
Thank you, Prime Minister. Good evening, everyone. We will follow the slides. Okay. So this is the situation update for our country with respect to COVID. As of yesterday, the 27th, we have 23,263 confirmed cases and 422 deaths. You would notice on the slide, to the right of the slide, you would see the number of tests that were done. We have 131 positive antigen tests out of a total 3,610. And we have 315 positive PCR tests out of a total of 1,094. A total of 446 positive tests out of a total of 4,704 tests done yesterday. Next slide. The distribution of the cases, we have 422 deaths, and the distribution between male and female, where we have 190 deaths that are female and 232 male. certainly an increase in the male population over the female, with a 2.2% positivity rate in males. Next slide. This gives us the age distribution of COVID-19 deaths, and we've put up this slide again to show the vulnerability of the older groups, where we can see clearly that it is over our 60 age group that we are having our largest case fatality rates, and certainly this is why this group is prioritized for vaccinations. Next. This gives us our epidemiological curve, and as you can see, that we would have, our case numbers would have started going up from early January and have continued to go up, and we are still increasing. We have not plateaued as yet, so even more important why it is that we need to have some restrictions in order to prevent the case numbers from going up further. This slide speaks about the reproductive rate. And here you can see that while it is that we are not at the highest number in terms of reproductive rate, we're actually at about 1.3 compared to in the past where we have had numbers at 2 over 2. We would see that because of the number of positive cases, certainly if you have 400 positive cases and you have a reproductive rate of 1.3, it means that we expect over 400 persons, almost 600 or so, to be infected by this set of 400 persons. So because of the larger number, it is even more significant where the numbers are concerned, even though the reproductive rate is at 1.3. Next slide. And this gives us an example of just working out the numbers to say that if we count on January the 22nd, where we had 118 cases, and we assume a reproductive rate of 1.3, by the end of the week on January the 30th, we would have 438 cases with a reproductive rate of 1.3. And in the table next to that, you can see that as the reproductive rate goes down, you see it going down from 1.3 to 0.7, that our numbers would be expected to go down. But certainly, even at a reproductive rate at 1, at this time, we would be expecting to see a large number of cases. Here we look at our epidemiological curve for each parish, and what we can see from this is that in all our parishes at this time, our numbers are in fact increasing. And this gives us an example, probably to be examined at a later time in more detail, of the reproductive rates per parish, where you can see that there is a range from 1 to 1.6 up to 2. In terms of confirmed COVID-19 cases and deaths, we will see that as the number of cases go up, which are in the blue blocks, then you will see that also our number of deaths, which had settled down and had come down before, are now also increasing, as well as our number of moderate, severe, critical cases that is in blue. In terms of our positivity rate, here we can see the positivity rate is demonstrated by the purple line. You can see that that positivity rate is going up. Over the last week, we've had a slight fall in the positivity rate with an overall 21% compared to 25% on the week before. But it's too early to say that there's a trend down in the positivity rate, and so we will continue to monitor this. Important to note, you will see that positivity rate of 11.6%, which represents the overall number of positives compared to the total number of antigen and PCR tests done. As the Prime Minister had started to explain, we use a corrected positivity rate because of the type of persons that are doing antigen testing in the private setting, which are mostly travelers, mostly asymptomatic persons. The pickup rate for the positives are a bit lower than we would expect. Therefore, to use that positive number, that number of positive cases, a few number compared to a large number, as you had seen in the first slide, about a 3% positivity rate in terms of the antigen testing, it would give us a wrong impression of what is truly happening in country, because we know that there are a lot of false negatives in that set, and these have not gone on to do PCR testing for confirmation. Hence why we have a corrected positivity rate at 21% that is denoted in the red line. Here we quickly look at what's happening across the parishes, and we can see that our problem parishes still remain St. Catherine, Kingston and St. Andrew, St. James, and we've had increase in cases in Clarendon, in Manchester, and in St. Anne. So the precautions, persons in those parishes really need to pay particular attention to precautions. Again, looking at our communities across the country, we can see heavily that parishes of St. Catherine, Kingston and St. Andrew, St. Anne, and some of the southern parishes are affected with positive cases over the last 2 weeks. In terms of hospital utilization, and this is where, as a country, we are really feeling the pressure now in terms of the number of cases. When we look at the number of cases that are occupying our beds, we can see in the top graph that that number is going up. Now, we would have seen that at each upward bend in that curve, this would have followed an increase in the positivity rate. So every time we have an increase in the positivity rate, we have an increase in the number of cases being hospitalized. And I just want to emphasize that it is not necessarily an increase in the number of cases that are tested. It is really the number of positive persons, the percentage of positive persons that is really the hospitalizations are tracking. When we look at the percentage of beds that are occupied, the red line in the top graph is 100%. And you can see here that the number of hospitalizations, the percentage of beds that are occupied, are now almost at times passing 100% of the beds that are dedicated for COVID-19. This graph shows us that the number of admissions per week has been increasing. So it is not just a matter of that we have patients that are long stayers on the beds, that are occupying the beds, that are causing us to almost be at 100% positivity rate. The fact is that since December, we have seen where we had an average daily admission of about 20 to 25. Now we have a daily admission rate for COVID, suspected or confirmed cases, of between 45 to 50. So the admissions per day are in fact increasing. So this gives us a picture across the country what our hospital occupancy looks like as a result of this increase in cases. And here we can see that certainly the western region and the southern region, in terms of general occupancy rate, the Falmouth Hospital, Maypen Hospital, Black River Hospital, and Lioneltown Hospital are certainly in the alert zone in terms of the general occupancy. And in terms of isolation capacity, we have several more hospitals across each region. In the western region, Cornwall Regional, Noel Holmes, Savlamar; in the northeast region, Port Maria, St. Anne's Bay, and Notta Bay; in the southern region, Mandeville Regional, Maypen Hospital; in the southeast, Spanish Town, KPH, Princess Margaret, and National Chest, that are all above the alert zone in terms of our isolation capacity. So in summary, what we are definitely seeing is an increase in the number of cases noted from the epi curve. We are noticing an increasing positivity rate. We are noticing an increasing hospitalizations from general occupancy, isolation capacity, and our admissions rate. And this translates from more exposure in our communities, more persons who are symptomatic, and therefore a need to decrease the movement in our communities at this time. Thank you.
You will agree with me that that was a very comprehensive presentation. I'll now invite Minister Tufton to give you even more details about our health system and some of our plans to increase capacity. Minister Tufton.
Thank you very much, Prime Minister. Colleague cabinet members, permanent secretaries, our chief medical officer, other government officials, members of the media, ladies and gentlemen, good evening to you all. Today, we stand at a new phase of our experience with COVID-19. Since February 2020, a full year ago, the team at the Ministry of Health and Wellness has had as our main objective the management of the spread of the pandemic in a way that would not overwhelm our health infrastructure. Over the year, we have seen and heard of the devastating impact that COVID-19 has had on other jurisdictions and in other countries, in many cases, countries that are far advanced and more resourced than us. We understand or understood at the very beginning that this battle was going to be long and that we would be required to employ all the tools within the public health system to respond. To date, we have had significant successes in the management of the pandemic. This has not been without, of course, the full cooperation of the Jamaican citizens. On behalf of the health team, as indeed on behalf of the government, I would like to thank the Jamaican people for their support to the team as they battle the pandemic in the field over the past year. Many of you have sacrificed many of your freedoms, leisure activities, and financial resources to ensure that you protect not only yourselves, but your families, your neighbors, and by extension, the country. And we in public health appreciates this partnership, and certainly in this time of an increasing challenge associated with COVID-19, we urge you to continue that partnership. To this point, the public health system has moved our strategic interventions through the 5 stages of the pandemic, and we spoke about those 5 stages in the early when we started off. At the beginning, we closed our borders and quarantined persons coming into the island. When we had our first case, we had the full participation of the Jamaican public in closing of schools and reducing movement within the society to slow the spread of the virus. Remember the quarantining of communities like Bulway in St. Andrew and Cornpeace in Clarendon. We remember the quarantine of St. Catherine and the restriction placed on individual households as we sought to delay our transition to community spread. These sacrifices allowed us to protect livelihoods and prevent the spread of the disease. But more importantly, they were done in full collaboration with all stakeholders within the Jamaican society. The increase in the number of COVID-19 cases in the country remains a cause for concern, and an increasing cause for concern based on what the Honourable Prime Minister said earlier, and this is the report of the CMO. The increase means more active cases requiring management by the health team. A portion of these active cases would require monitoring in hospitals, and so a rise in the hospitalization of COVID-19 patients have become our reality. As of today, we are realizing a hospitalization rate of some 7%. That is of the total number of persons who are tested positive for COVID-19. Approximately 7% of those are serious enough to require hospitalization. We now average some 48 admissions per day across all our hospitals. Based on the epidemiological data, we're averaging an infection rate, or R0 rate, as said earlier, of 1.3, which means that every person infected with COVID-19 will infect approximately 1.3 others. If this rate is not reduced, we will continue to see a rise in infections, which will ultimately lead to an increase in the number of persons that are hospitalized. Now we're at a new stage of the fight, and again, the public health team is required to collaborate with all stakeholders to achieve the clear objective of preventing the overwhelming of our hospital infrastructure. As at February 26, 2021, all beds that are currently dedicated to COVID-19 isolation are full. Accordingly, the ministry is now implementing its surge plan that has been developed to respond to the increased levels of hospitalization. In implementing the plan, the following actions are being taken. St. Joseph's COVID-19 ward at St. Joseph's Hospital, this is a 36-bed facility, is now in operation with an occupancy of approximately 8 persons. As the weeks move on, we will admit more patients to this ward based, of course, on the infection rate. Falmouth Hospital COVID-19 ward, this 36-bed facility is now fully equipped and will begin to admit patients on Thursday, March 2nd, 2021. While the building is complete, the appropriate infection prevention and control measures must be completed before the building is safe, especially for patients with severe acute respiratory illness. So that will be opened later on this week. Field Hospital, we have moved the field hospital that had been generously donated by the United States government. This hospital is now to be housed at the Spanish Town Hospital grounds, where the 40 beds will be used to support patients in that facility who are suffering from COVID-19. And at the University Hospital of the West Indies, there's some conversion taking place from regular wards to COVID wards. The management of the UHWI has now completed the conversion of an additional ward for the admission of COVID patients, numbering some 24 beds. In terms of overflow wards, or a partnership, public-private sector partnership with the Andrews Memorial Hospital, we want to express our thanks to that institution for the 15-bed non-COVID facility that is established at that location, which will take some of the pressures off the regular hospital system in the corporate area so that we can dedicate more time to COVID support should we need it. Now, the hard infrastructure is but one of the critical elements to address the challenge. The other very big component is our human resources, our personnel, our health team. Beds are not the only response in this surge plan, therefore, so we have increased hiring of staff in the Southeast Regional Health Authority and the Western Regional Health Authority, which have the main Type A hospitals. In the Western Regional Health Authority, which consists of St. James, Trelawney, Hanover, and Westmoreland, 18 additional temporary doctors have been approved, with 6 receiving contracts to start tomorrow morning. 42 nurses, assistant nurses, and patient care assistants are being hired, with some 14 being interviewed tomorrow, Monday, March 1st. In the Southeast Regional Health Authority, that consists of Kingston, St. Andrew, St. Thomas, and St. Catherine, 43 additional temporary doctors have been approved, with 4 receiving contracts to start tomorrow, and 236 nurses, assistant nurses, and patient care assistants are being hired, with contracts being finalized for deployment within the next 2 weeks. I pause here from my script to also highlight a challenge that we face, a real challenge, which is the mass recruitment of our public health team. The University Hospital alone, they tell me, from January to date, 2021, have lost over 70 nurses who have been recruited by other countries, paying much more attractive salaries, of course, trying to address their own issues. And so that is adding to the pressures in the system and contributing to the lack of personnel to deal with the challenges that we face. I want to turn now quickly and finally in this section to therapeutics. The average length of stay for COVID-19 patients in hospital is now 14 days. And with a 7% hospitalization, if you do the math, you realize that we have to keep adding beds unless we cauterize the problem. This is 3.5 times the average length of stay for other patients who average about 4 days or so in hospital. With this reality, the throughput of a COVID-19 bed is far less and therefore results in an aggregation of admission in hospitals that exacerbates the need for beds. As such, investment in the clinical management of patients to ensure their safe recovery in a shorter period of time is absolutely essential. So the Ministry of Health and Wellness has a responsibility, however, to ensure that recommendations given from a policy level regarding medicines and therapeutics ensure that medicines with proven safety, effectiveness, and efficacy are available to the population. The use of unproven drugs can lead to a waste of resources, harmful effects, and can also reduce the availability of the drug for its recommended use. On review of the data concerning ivermectin, we conclude that further studies are needed to guide recommendations for use at a policy level. The data available for the use of ivermectin in COVID-19 has been extensively reviewed by the National Institute of Health in the United States and the U.S. Food and Drug Administration, the FDA, and has concluded that there is not enough evidence to recommend for or against, that's for or against, in the COVID-19 response. The WHO and PAHO has also indicated that more clinical studies are needed as it relates to the use of this particular drug. The drug used as labeled as an antiparasitic and not for COVID-19 has been found to be safe. So it's a safe drug, but it is prescribed for or as an antiparasitic, not prescribed for COVID-19. We know that there is mounting pressure both locally and internationally from medical professionals as well as other private sector organizations for national regulatory authorities to provide approval for use in COVID-19 as a policy directive. We also note that there are some fairly large-scale studies that are underway, and we await those outcomes to provide further guidance on safety and efficacy. The Ministry of Health and Wellness has spent considerable time, the team, reviewing the information, and have also concluded that more information is needed to recommend for or against the drug for use in COVID-19. We recognize, however, that in patient-doctor relationships, some doctors and their patients are using the medication for treatment of COVID-19 based on the available information. This is ideally done in the framework of a clinical study. In these situations, there should be discussion and agreement between patient and doctor and appropriate documentation and follow-up. Ivermectin is currently recommended by the manufacturer for human and animal use as an antiparasitic medication. There has been previously no demand for human use in Jamaica, and no preparation for human use is presently registered in the country. Animal preparation are not to be used in humans. There has been no application for registration of the drug by any distributor, and the ministry will expedite registration of the drug for its labeled use as an antiparasitic once we receive an application. Where doctors choose to prescribe for patients, we urge that the following is observed. Firstly, that it is known that there is insufficient evidence to establish safety in pregnancy. Safety in children has not been established. No pediatric data to support use for COVID-19 in children. And finally, effective and safe dose for COVID-19 treatment has not been established through the well-designed studies that have been done to date. And this is where I'll stop for the time being. Thank you.
Thank you, Minister Tufton. From what we have said, it is now clear, or should be clear, to the public that our health system is at a critical limit. We are trying to increase the capacity of the health system. Minister Tufton just told you about the new beds that we are putting in. But again, I stress that this is only a temporary measure, because if the numbers continue to rise very quickly, the capacity that we have put in will be used up. And, we can only increase the number of beds within the existing hospital space. And it takes us a year, 2 years even, to build a new hospital. So it is only a short-term measure. So the pressures that we are seeing on our health system clearly indicate the need for decisive action. The Cabinet met yesterday and agreed on the following measures under the Disaster Risk Management Act, commencing March 1, 2020. 2021. Oh, we really need to forget about 2020. It's such a terrible year for us. Yes, so generally the measures are for 3 weeks in the first instance, and of course are constantly under review. However, given the need for notice to facilitate implementation, not all of the measures, the new measures, will come into effect as of tomorrow. So the curfew hour will remain at 8 p.m. nightly to 5 a.m. the following morning until March 23rd, 2021 at 5 a.m. Let me say a few words on the curfew. I've heard the common logic being expressed that the use of the curfew suggests that COVID only infects at night. As I said, it is a common logic, but it is not common sense. The truth of the matter is that we are trying to control movement on one hand, and on the other hand, we are trying to keep production going as much as possible. Where we have the most production taking place, obviously, would be in the day. Working hours, usually 9 to 5. If you look at our energy consumption, significant energy consumption is in the daytime. Most workplaces and businesses operate in the daytime. So you would want to sparingly use any measure that controls movement during that period of time. Instead, you would use other measures, such as institutional measures, how businesses can operate, and we use situational measures, wearing your mask, social distancing. But in the night, when the general production activities are less, that is when you would seek now to apply your movement measures, mainly your curfew. I just thought I would deal with that very appealing logic, which is not very logical when placed in the context of trying to ensure that we keep our production going and at the same time control spread. Now, in doing that kind of balancing act, controlling spread and keeping production, we recognize that for businesses that operate or normally operate and continue to operate during hours that we now classify as curfew hours, for example, the quick service industry, the restaurant industry. And I'm very careful here to note that when I speak of the restaurant industry, I'm not talking about the big brand name stores alone, but the big brand name Pan Chicken Man on Red Hills Road or in Ligani or wherever else that there may be in my constituency, which I have to mention on the hip strip in Olympic Way. They are part of that quick service industry. So we are very concerned because that industry employs a significant number of Jamaicans. It contributes to the income of many households. So we know that the curfew hours is greatly impacting that industry. It is not beyond us, however, to find solutions to allow for what I like to call the emergence of the delivery economy. The delivery economy is emerging even without government market-making activities. It is emerging naturally as businesses migrate online, as service fulfillment websites and so forth become popular. The configuration of how fulfillment happens changes. So before, the common fulfillment would be for the consumer to go to the place of consumption, meaning that they would go to the store or to the supermarket and pick up the goods. With the online economy, that is flipped around. What happens is you stay at home, you place your order, and it gets delivered to you. Of course, that is the business model for Amazon and many other big businesses that operate within that space. Right here in Jamaica, that is happening, and we see that delivery economy emerging. So the question for the government is, how do we facilitate delivery during the curfew hours? Many issues that would have to be resolved. The question of equity. Is it only the big stores that would be able to do this? How do we facilitate, as I said before, the Pan Chicken Man on Olympic Way or on Red Hills or wherever else that they may be selling? How do they get facilitated? So we're studying that now in detail. We have asked the Private Sector Association of Jamaica, Private Sector Organization of Jamaica, rather, to assist. I had a presentation from them a few nights ago, which showed how it could be done. So we have a subcommittee of cabinet now looking at how we could actually implement. We have agreed that we will do it, test it first in a geographical area, and as soon as those details are refined, we will bring that to the country. So we would still maintain the curfews as they are needed, but we would find a way through the delivery economy to ensure that production can still happen, business can still happen during the curfew hours. Zoos, parks, gyms, attractions, and bars will be closed at 6 p.m. And this will continue in effect until the 22nd of March 2021. And I don't need to explain why we have to do this. This is another measure which is both an institutional measure and it is also a measure of controlling movement. So by 6 p.m., zoos, parks, gyms, attractions, and bars, starting the 1st of March to the 22nd of March, they will close at 6 p.m. I've received many complaints of persons pointing out that there are certain enterprises, certain entities who continue to operate even after the curfew hours. We see long lines of motor vehicles parked up. We see these places crowded, persons not maintaining social distancing, and definitely they will tell you they can't eat and wear the mask, and they certainly can't drink at the bar and wear the mask. I am going to be explicitly clear. Commissioner of Police is here, and we have said to the police that there must be strict enforcement of this 6 p.m. Closing time. Minister Williams is here with us. Minister Williams, you may want to join me and say a few words about schools. Only students who will sit examinations. and let me be clear now, only students who will be sitting exit examinations, meaning for the primary level would be the PEP, and for the high school level would be CSEC and CAPE. So only those students would be permitted to have face-to-face instruction, and this will be the case from the 1st of March until the 22nd of March. Now, just to be clear on this, if the school is not giving face-to-face instruction, then that's fine. But if the school believes that they can put in place all the measures to have it, then it would be permitted. Is that the case, Minister? You want to come and explain it?
So as explained at the press conference last Wednesday, for our public schools that are allowed to be in the face-to-face mode, we have said that only children who are studying for the exit exams, which will be grade 6 in the primary schools, and grades 11, 12, and 13 in our high schools, that will be allowed in those schools that have been approved for face-to-face. As you're well aware, not all our schools are yet approved for face-to-face, so we are addressing the ones that are approved for face-to-face. I'm sure the Prime Minister will talk about private schools, because as you know, private schools, the rules under the Disaster Risk Management Act applies to those schools and not necessarily the directive that comes from the Ministry of Education, Youth and Information. So again, it's our students who are doing the exit exams in grade 6 in our primary schools, and in the high schools, grade 11, 12, and 13, for those schools that are approved for face-to-face. Thank you, Prime Minister.
All right, so there you have it from the Minister of Education. So there are some schools that were pre-approved. Only those schools can carry out, if they choose to, because they may choose not to, if they choose to, face-to-face, and it is only the exit exam grades, meaning grades 12 and 13, fifth form, 11, 12, and 13, and grade 6. Perfect. As it relates to private schools, now, we made an exemption, or rather an exception, to allow face-to-face for private schools. Because of this stage that we are now and the threat that we face, the same rules that we are applying to the public schools will be applied to the private schools. So now, for private schools, the only face-to-face that they are permitted to have would be if they are doing grades 11, fifth form, or sixth form, 12 and 13, and if they are doing grade 6, which would be PEP. Those would be the only face-to-face interaction that would be allowed. Otherwise, the entire education system, public or private, should move to online or other modalities. I hope that that is clear. And this would be from the 1st to the 22nd of March. Now, in the early days of the pandemic, and I'm using terms as if the pandemic has been around for more than a year, but early last year, we instituted a measure which was work from home. The measure in the current orders encourages firms to make it possible for their employees to work from home where possible, where convenient. We're changing that order now. Starting Thursday, March 4, 2021, there must be a work from home arrangement in the public sector, and the permanent secretaries are directed to have only persons who work in critical service delivery and where the nature of the work performed requires that the job functions be performed at the physical office location. This means that for the public sector, meaning ministries, departments, and agencies, there is now a hard work from home rule. The rule will be determined by the permanent secretaries. The permanent secretaries are to determine what are critical mission services, in other words, services that are needed to keep the agencies, the ministries functioning. Those are permitted to work from work, but everybody else should be working from home. And this will take effect on Thursday, the 4th of March. So this would give us 3 days to make preparations for this work from home order. I'm being told it should be stay at home. Oh, yes. No, it's a work from home order. I'm coming to that one. Thank you, Merle. I'm just making sure I have everything here in order. All right, so the private sector is encouraged to arrange their affairs in such a way as to facilitate their staff working from home. So we are not placing a hard and fast rule on the private sector, but we are expecting that they will follow suit and make their arrangements to allow their staff to work from home where it is possible and convenient. We already have in the order the provision that where a member of staff has a comorbidity, serious illness, has to take care of someone who is ill or someone who is physically or otherwise challenged, that person should be allowed, if they request it, to work from home. And I want to emphasize that here as well, and that rule applies both for the public sector and the private sector, and that is in the Disaster Risk Management Act. So I just want to go over once more so that we're clear on the work from home. There is a strict work from home rule for the public sector. This means that the permanent secretaries and the other executives of agencies and departments will be looking at their business processes. They will be determining what is mission critical and what can only be done in a physical sense, in presence at work, and those persons will be permitted to come to work. Everyone else must work from home from the 4th to the 22nd, or until we give other such directions. For the private sector, you are mandated to do similarly, review your business processes, and where it is possible and convenient, we encourage you to have your staff work from home. If there is a member of staff that has a comorbidity, or has someone who is ill at home, or has someone who has some challenges, mental, physical, otherwise, that person can apply or should apply to their employer, and the employer is obliged to allow them to work from home. That is specified in the order. The public gathering limit will remain at 10 persons until March 22nd, 2021. we did not seek to adjust that down any further. If we find that we are not hitting the plateau that we are expecting by virtue of the present measures, then you could see this number go down to 5. But for now, we will keep it at 10. This is a very important number. It creates confusion. I know some people don't know how to interpret this number. But just to go back to the reproductive rate of the virus, if where we are now, the probability of someone who is infected infecting others, 1.3, meaning that an infected person has a 100% chance of infecting at least one more person and a 30% chance of infecting someone else, if you want to interpret it that way. If that infected person is in a large crowd, then the probability of him infecting more persons is greater. If you reduce the size of gatherings, then you reduce the probability of infection. So what that tells you as a citizen moving about with such a high rate of infection is that you really should try to avoid close contact with persons. If you have to go out on the buses, in the market, walking on the road, try to avoid a crowd. If you are going anywhere and you see more than 10 persons, as I like to say, take away yourself. Move away. All right? You don't have to feel as if you are insulting anyone if you said, don't stand so close to me. These are the measures that we will have to take to protect ourselves and bring down the numbers. So we are now well, it's not a recommendation, it is in the order. No gathering more than 10. Now, as it relates to that, public sector entities are directed now that social events, and I like to keep the handing over ceremonies and the launches and the groundbreaking because this government has done so many projects. But unfortunately, all of that will have to be on hold for the next 3 weeks. So the entire public sector, ministries, departments, and agencies, statutory bodies, the like, are directed no social events, no ceremonies, unless they are virtual. That means that they are being done online, and we don't have a gathering to do it online. So permanent secretaries, heads of departments, the executives, they will ensure that this is done. Early in the day, we placed a measure when we started the controlled re-entry of non-Jamaicans into the island, where we required testing, pre-testing. At that time, we also contemplated testing for Jamaicans. We studied it very carefully, and we thought that based upon everything, the legal considerations, the stress it would place on our traveling population, that we would not require them to test. We had great faith that our Jamaicans coming home would have this very high sense of patriotism and understand that the pressures that our system would be under if they were to behave in deviant ways from what we recommend as socially responsible in the pandemic. It has not always been the case that our traveling Jamaicans do this, certainly in the maintenance of the quarantine. And it is having an impact on the numbers. Given this weight of consideration and where we are, where it is now a threat to lives, because that's what has happened with this new spike, which is causing an increase in the number of beds to be occupied. It is now a threat to life. It can increase our case fatality rate. We think it is now justified in these circumstances to require Jamaicans coming home to present a negative COVID-19 test, which was conducted within 72 hours prior to the travel date at the check-in for their flight. This applies not just to Jamaicans. Remember, it was applicable to non-Jamaicans before, to some non-Jamaicans traveling. Now, everyone coming into Jamaica, I want to be clear on that, everyone coming into Jamaica must present a negative COVID-19 test, which was conducted within 72 hours prior to the date of travel. And they must present this at check-in. You will hear more about this as the order is made public. In addition, business travelers were always required to present their tests, and they were tested again, and upon a negative test, they were allowed to go and do their business and return to where they were staying. This will continue to be the case, but they must also present a pre-test. They will be tested, but now we are going to require that they pay for their tests. The government has to shift this burden because obviously the limited budget that we have in every area we have to try and save. So we will shift the burden of the PCR test onto the business traveler. UK flights, we continue to restrict flights coming directly from the UK, and this will continue until the 22nd of March 2021. Now I want to enter upon an area that I know is extremely sensitive. Cabinet deliberated on this for over an hour last night, and this is a matter of funerals and burials. We don't want to trespass upon the rights of our citizens in these matters. Losing a loved one and going through the funeral process and the grieving process can be quite difficult. But we also have to balance the lives, the safety of those who are living among us. Because what we see is that even though we have placed restrictions on funerals, and we made some exemptions to have funeral memorial services in the church and the funeral service to have the same number as at the graveside, which was 10 or 15, 10 mourners and 5 clergy and attendants. We notice that our Jamaicans are becoming very creative, and the funeral service is happening right at the burial ground. I have seen, and many of you would have seen the videos circulating of massive funerals still taking place. There is no way that we're going to reduce the numbers of infection and by that reduce our positivity rate, reduce our bed occupancy rate, and maintain our case fatality rate if we allow this to continue. So the new measures as it relates to funeral, effective the 8th of March to the 22nd of March, funerals and burials will be prohibited. We have given a directive to the municipal authorities that no burial orders should be issued. And let me explain what this means. So from the 1st to the 7th, funerals that were already scheduled, which we think is only fair, we give notice. So those funerals can go ahead. but they must conform with the rules under the Disaster Risk Management Act. 10 mourners and 5 inclusive clergy and attendants. 15, no more. Again, we have asked the police to be strict with this. After the 8th, there will be no funeral permitted, no burials permitted until the 22nd. We have to take this drastic action because we do not see any willingness on the part of our brothers and sisters. Not everyone, some people do comply, but we are seeing a significant level of non-compliance in this area. In terms of worship services, we have not yet had an opportunity to meet with the churches. We have communicated through messages and telephone calls. I will be meeting with the church. Hopefully we can do it next week, early next week. But we have had some indications that the church would cooperate with these measures. So we have amended the orders as it relates to worship services. So for the period March 1st to 22nd, we have placed new orders, new measures in the orders, and we know that our churches will self-regulate. And I must say here that our churches generally, since we have put in place the orders regulating services, that the churches have owned it and they have by and large followed the rules. So I'm very satisfied with the leadership that our churches have shown. So now churches will be directed to engage in only online services for the next 3 weeks. Online services only. Except that we will permit 10 members to be within the church space to deliver the ceremony and do the necessary management of the communication equipment and so forth. So we will permit 10 members in the church to conduct the actual ceremony, but the ceremony must be televised, carried online. Weddings. We will continue to allow weddings, except that the cap that we had placed on weddings, which was 50, we have now halved that, so only 25 persons, including the bride, groom, who else we need? The bride, groom, pastor, and the 2 witnesses, right? Of course, you can have your best man and the maid of honor and a few others, the mother and the parents of the bride and the parents of the groom. 25 is good enough. I mean, I'm sorry to do this, but we have to do it. So I really hope that we have not disrupted anyone's wedding plans. But for the next 3 weeks, this is what we will have to do. And this is now in the order. Public beaches, which are not under the direct control and management of an entity or authority. And these beaches, whether they are licensed under the Beach Control Authority or not, and rivers, are closed until March 22nd, 2021. So I know we have seen a resurgence of persons going to the beaches. There is all kinds of talk about you can't catch COVID in the seawater and all kinds of things, but you certainly can catch it when you all get back into the cars to go home. Right? So we have to take this measure, and again, this will be strictly enforced. Minister Mackenzie will have his team going around to ensure that there are no breaches. So these are the set of measures that we have put in place. And I must again emphasize that these measures will work. There's no question that they will work. However, these measures are costly. We are now about to deliver our budget. Well, we have tabled the budget. We will be going through the process. And we are seeing the impact of the pandemic on the economy, certainly in terms of the cost of the health mobilization that we have to do, but on the production and commerce that we have had to forego because of these measures. So we have a trade-off on the kinds of measures that we can use. We know that if we use movement control measures, those have the most deleterious impact on our commerce, on our economy. And when I'm talking about economy, it's not just the big company. You know, it's Pam's Bar on Olympic Way. It's the little grocery shop in West Kingston. It's the fruit stall vendor in Papine. How can we manage the pandemic without destroying the economy? We can do this if every citizen acts responsibly. In preparing my presentation, I tried to craft the narrative in a way that people can understand. Some people, they have reached a point in the pandemic where they just want to live. Tired of COVID now. I want to go out and enjoy myself. I want to still go to my parties. I just want to live. And there are others who are saying, well, you know what, I don't want to die. So I'm going to stay home. So we have these two diverging views in the society. My job is to balance it. I still want you to be able to enjoy yourself, to go to the beach, to have a drink and so forth, and to work and produce. But I also have a duty to protect that person over 60 who has a comorbidity. That your action in going to that party, that illegal party last night, and we all see the videos of them circulating, that illegal party, nothing is going to happen to you. You are young and fit. But when you leave that party and you go and mix now with that vulnerable person, you put their life at risk. So where we are now in the pandemic is that it's not now just livelihoods at risk. We are now at the point where lives are genuinely going to be at risk if we are not able to provide them with treatment in the hospital. I have received the calls, Somebody wants to get into the hospital just 2 weeks ago at the university hospital. I had to call Minister Tufton, and Minister Tufton said to me, "Why, Prime Minister, the hospital full." It's the reality. So I'm asking my brothers and sisters, my grandmothers and grandfathers, my aunts and uncles, my friends, that we have to take greater responsibility for our actions in the management of the pandemic. The government has to act in these ways, but these ways also kill the economy. If you act responsibly, then we will use these measures less. I want to turn now to vaccines. Much has been said about our management of the process. Minister Tufton will give us some more details on that. But I just want to first of all say my heartfelt appreciation and thanks to Prime Minister Modi and the people of India for considering Jamaica as one of the countries that would receive a donation of 50,000 units of the 50,000 doses of the vaccine, and that should be arriving in Jamaica in short order. The conversation around the vaccine, I found it to be quite disappointing and indeed quite shameful too, because the people who are commenting and leading the narrative would well know that governments cannot negotiate bilaterally, multilaterally, and even commercially in public. That once we initiate negotiations, sometimes there are clauses in agreements. Sometimes it is just appropriate that we do not disclose these negotiations until they are at the point of fruition. Now, not because we haven't said anything doesn't mean that nothing is happening. And that gap between the point of initiation of negotiations and the point of fruition leaves a gap. And within that gap, persons have sought to exploit it by creating narratives of chaos and confusion. Quite unfortunate with a matter of vaccine which is of national importance. We have always been very clear and upfront with the people of Jamaica. We were first out of the blocks to say once the vaccines are available, we will make it. Once they are available and certified as safe, which is what we did as a government. We did not accept any vaccines until they were certified. So when others were saying, why you don't take the vaccine? I wondered if that is what they would have done if they were at the wicket. Again, we must resist the urge for cheap politics. We have been following closely this vaccine issue. A lot of politics around vaccine. I have been on international fora speaking out against the hoarding of vaccines because it is a reality. It is a reality of the world. The countries who have the capacity to purchase it and produce it, they are going to vaccinate their population first. We are part of a multilateral system, and we, for our foreign policy and strategic reasons, we defend multilateralism. And that is why we participate in things like COVAX and the African platform, which will secure supplies for countries like Jamaica who may not have the resources and the capacity. But even then, we are not going to be first in the line. We have to depend on global institutions because we wouldn't have the institutions here to certify definitively whether a vaccine is safe or not. So these are considerations that your government takes in your behalf, not cavalier, not careless, but for your safety. And we can't just go and secure any deal because you can get a vaccine for $50 and you can get one for $4. And we have to negotiate. But more than that, what we would not want is to bring vaccines here and we are not ready to distribute it. Because the vaccines have a definite shelf life. So we have to time supplies to make sure that when the vaccines land here, very quickly we can turn them around. We received a presentation, which we will share with you later on, about how this will be done. Very granular, very detailed. And before I invite Minister Tufton and Minister Johnson-Smith to give you some more detail, we would like the public to be assured that at our cabinet meeting last night, we settled on some fundamental principles as to how the vaccines will be delivered. Priority number one, principle number one, is that the vaccines must be delivered on a basis of equity. Equity, meaning that those who need it the most, those who are most vulnerable, those are the persons who should receive it first. Second principle is efficiency. If we offer you the vaccine and you don't take it, then we will move to the next person, because we can't leave it there waiting on you. The vaccine will spoil on us, we lose the money. So we're going to find the most efficient path of delivering the vaccine. The third principle is transparency. I'll find another word for it, but I'll use transparency for now. All our ministers, all our political personnel have been directed that they must not interfere in the established schedule of inoculation. Nobody must call any minister or any political figure to jump the line for vaccination. And I'm very clear on that. If it comes to my attention, there will be serious action. The public must be assured that there is no favoritism in vaccination. So once the minister and his team, meaning the permanent secretary, the CMO, and the other hard-working officials of the Ministry of Health, determine what that vaccination schedule and priority is, then nobody must pick up the phone and say, "P.S., put it my friend now," or "I know this lady." That cannot work. So, Minister Tufton.
Thank you very much, Prime Minister, for that very passionate delivery. We in public health appreciate that level of decisiveness and clarity in terms of the approach, and we would have it no other way, and we really thank you for your leadership. So, as it relates to vaccines, based on our instructions from the Cabinet, and Prime Minister did say we met last evening for quite a while, well, from the day into the night, the Ministry of Health and Wellness, in collaboration with the Ministry of Foreign Affairs and Foreign Trade, my colleague Minister Johnson-Smith, are the sort of leads on securing vaccines through various discussions, negotiations, bilateral and otherwise. I wish to thank again, as the Prime Minister said, the people of the government and people of India for their donation of 50,000 vaccines, something that has been in the works for some time, but the most significant clarity brought to bear on it with the announcement by the High Commissioner this past week. This shipment is expected to land in Jamaica on or before Thursday of this week. I wish also to announce the provision of an additional arrival, some 14,400 doses of AstraZeneca vaccine that will be delivered to the island on or before March 11th, and this is part of the COVAX arrangement. This supply represents the first installment of a total allocation of some 124,800 doses of vaccine under the COVAX arrangement in the first instance. Remember now we had said that we would get up to 900,000 for supplies at a 2-dose per person, approximately 450,000 individuals. So in the first instance, we're to get 124,800. We will get a small amount of that, but nevertheless, we appreciate on or before the 11th of March, some 14,400. That has been signed off on, all the arrangements made. It's just the logistics now of moving that from Europe. It's in, where in Europe? Amsterdam to Jamaica. The other allocations in that first batch we expect between now and May this year, 2021. We can now confirm that the allocation under the African Medical Supply Platform, another avenue that we've been working on and involving CARICOM, has been approved for a total of some 1.8 million doses of vaccines to be supplied to Jamaica starting in April, which is, of course, next month, April 2021. So that's another stream. As stated in previous press conferences, the mandate is to identify and source some 3.5 million doses of vaccines by March 2021 to apply to approximately 65% of the Jamaican population. Before I ask Minister Johnson-Smith to come to elaborate on some of those discussions, because we do discern that the public has been asking, and to the extent that we can provide greater clarity, she, I'm sure, will do so. I just want to take the opportunity again to ask Jamaicans to prepare themselves for the vaccines that are going to be available in order, according to the Prime Minister, the priorities that are contained within the plan, the vaccine plan, which was tabled in the Parliament. So this plan speaks to who will get vaccinated first: healthcare workers, government officials, and government officials meaning government opposition, councillors, local municipal cooperation, the elderly, 60 years and over, the Jamaica Defence Force, the Jamaica Constabulary Force, the Jamaica Fire Brigade, Passport, Immigration and Citizenship Agency, and persons who work in early childhood, primary and secondary education institutions. So that's the first set of priority lists or individuals. This group represents a population of approximately 450,000 individuals who will need to take 2 doses of vaccines. Based on surveys among this population, work that we have been doing, on average, up to 40%, between 35 and 40% of persons have indicated their willingness to take the vaccines. 25 to 30% are unsure, are awaiting more information, and 25 to 30% have stated that they will not take the vaccine. Our target is some 65% of that group, and based on the information that we have, again, it's further justification for what we've been saying all along, that there's still a lot of work to be done to get Jamaicans to appreciate the value of the vaccine and them taking the vaccine. We have been criticized for marketing and PR, and sometimes I think not justifiably so, but the fact that we have the vaccines doesn't necessarily mean that persons will take it. And there's going to be a lot of work that will need to be done in the weeks and months to come, both internally within public health, but also through community outreach, public education, and other efforts to get a take-up of at least 65%. And if it's 65 to 70% is really the point where you would get the herd immunity that you seek, so that COVID, as a public health threat, will not be a challenge to the population and the country resuming normality and getting back to business. So it's very important that we get to that number as quickly as possible based on availability. On Thursday, March 4th, at our regular COVID conversation, which we have each week, we will give a detailed breakdown of the the arrangements that are being made, which was presented to Cabinet yesterday. But we do have a plan in terms of ensuring the logistics of getting the vaccines here, the inventory management and logistics arrangements to move it out into the field. We have identified 75 locations. We have trained over 550 healthcare workers. And up to Friday, I was visiting a few of the facilities just looking at the arrangements. So we will give a breakout and more details on that to reassure the public that we are comfortable with what the arrangements are, and we're just waiting now on the vaccines to be available. At this time, I'm going to ask my colleague, Minister, in keeping with the Prime Minister's earlier statement, to give an overview of some of the arrangements that are being made to secure additional supplies. Minister Johnson.
Thank you, Minister Tufton, and thank you, Prime Minister. The Ministry of Foreign Affairs and Foreign Trade continues to work closely with the Ministry of Health and Wellness and its agencies, including, in particular, the National Health Fund, on what is clearly one of the key focuses of the government at this point in time, the procurement of safe and tested vaccines. And I wish to share that, notwithstanding the fact that the very nature of these discussions don't lend themselves to public discussion, because that is the nature of diplomacy, that our outreach has been extensive and intensive. It has been at the bilateral level. It has been facilitating with multilateral organizations, through regional organizations, and through private entities, unusually so. Unfortunately, our silence, I think, on some of these matters has led to not only legitimate questions, but also opportunistic arguments. And that has been unfortunate. The Prime Minister has spoken to that. But I do believe that there are just one or two points that I could share to help contextualize the process through which we have been going. I've heard it said that, Jamaica has been late in our approaches, etc. And this is absolutely not so. I will share one counterpart who, in our discussions about where were good paths for us to approach in respect of vaccine procurement, he shared that his government had, in fact, paid for 10 million doses from October 2020, paid for, and they still had not received the very first one. The global landscape in terms of secure of supply chains and manufacturing processes has been extremely fluid and full of uncertainty and dynamism. And therefore, it is, I share that as an example to contextualize the type of uncertainty that governments the world over, regardless of size and financial resources, have been encountering across the space. I also want to just address a point that I think entered the public discourse last week, indicating that Jamaica had somehow said no to our friends and partners from the government and of the Republic of India in respect of vaccines, and that is why we are receiving them now, while others may have received them before. And I want to, again, debunk that. The letter of offer which we received was dated December 31st, which, of course, was Thursday, the last working day of the year. The Ministry of Foreign Affairs and Foreign Trade consulted with the Ministry of Health on the 4th, which was the first working day of the year, Monday, and responded on Tuesday, indicating our willingness and our gratitude to receive a gift in respect of in order, rather, to vaccinate our frontline workers, and that we looked forward to discussing the arrangements that could be made as soon as to ensure that they could be made available when approved for domestic use in Jamaica. And therefore, I hope that that will put to bed the type of discussion, unhelpful discussion, which has been taking place. I wish to add my own and my ministry's own personal thanks to the government and people of the Republic of India in respect of the donation which they have advised should arrive this week. and to remind the Jamaican public that this is part of a cooperative relationship, and we have received, as part of their global support of COVID response among partner developing countries, medical supplies, PPE, pharmaceuticals, and as early as mid last year and as recently as last week. So we continue to work with our partners and express our appreciation for their efforts in that regard. Minister Tufton already mentioned the African Medical Supplies Platform, which is an initiative of the African Union that was started by the government of the Republic of South Africa. And therefore, our outreach was to the government of South Africa. I spoke with my counterpart, wrote, etc. And we also made outreach through CARICOM, which had also had a direct connection with the AMSP. And Minister Tufton would have spoken to the more than 1 million doses which will be allotted to Jamaica through that platform, but perhaps didn't share that at the outset it was going to be 250,000. And through changing circumstances, as I spoke to the fluidity before, and our outreach through all efforts, including those of the NHF, that we now have a larger supply for procurement, which has been put in place. And again, we therefore express our appreciation to the government of the Republic of South Africa and to the African Union for having established this excellent platform, which is, again, another example of true South-South cooperation. We assure the Jamaican people that our efforts are being pursued on all fronts, and we acknowledge that in several of our bilateral partners who perhaps the public would have anticipated to be sort of initial benevolent partners in respect of vaccines, that they too have not only had more severe instances of the pandemic than Jamaica has, even to this day, and accordingly have domestic policies which are focused inwardly in terms of vaccination at this point in time. But we have engaged at different levels, and there is an assurance of support to Jamaica as those policies unfold and circumstances change. We continue to engage at different levels, formally and informally, and are 100% confident that our partnerships, our friendships, and our cooperative relationships are secure and enduring, recognizing that all of us are fighting a war against this same invisible COVID-19 foe. I wish to share, of course, again, that we paid into the COVAX facility and continue to work towards our receipt of allocations in that regard. And Jamaica, we had to pay as a self-financing country because we have been defined as a middle-income country according to OECD rules, and you would have heard us speak about this and advocate for a change of this regime. This is something we continue to do on behalf of all developing countries because it will affect us all if we're able to have positive movement in those policies. But we will continue to support the Ministry of Health and Wellness, to support the NHF and indeed the private sector, as manufacturers are often directing distributors to governments, and governments are directing others to manufacturers. There's quite an interesting cycle, dynamic cycle in engagements on vaccines at this point in time. And I just want to assure the Jamaican public that we are ensuring that whatever is sought is known to be safe, and whatever arrangement is made is transparent and effective and in the interests of the Jamaican people. So thank you, Minister Tufton, and thank you, Prime Minister, for giving me the time. Hello.
Thank you. Thank you, Minister Tufton. Thank you, Minister Johnson-Smith. And I believe we have thoroughly covered the subject. So now we are ready for your questions. But before we go into questions, I had overlooked one very important measure. and that is the stay-at-home order for persons 65 years and older. That is the existing order. Having looked at the statistics provided by the Ministry of Health, you would see that it is really 60 and over that are really facing the greatest threat at this point. So we have adjusted the stay-at-home order from 65 years to 60 years. So if you are 60 years and over, you must stay at home until the 22nd of March. So as of the 1st to the 22nd, for the next 3 weeks, placed in the Disaster Risk Management Act is the new stay-at-home order that requires persons who are 60 years and over to stay at home. And the stay-at-home order, which you can read, it's quite comprehensive. It does allow you to move about once per day to get the necessaries of life and for exercise. But outside of that, you should stay at home. We're now open for questions, and I want to thank you all for listening to us.
Thank you so much, Prime Minister, for your comprehensive update, and of course the ministers as well. May I also acknowledge the presence of the Minister of Local Government and Rural Development, the Honourable Desmond McKenzie, who has also joined us. Ahead of the start of the press briefing, Prime Minister, we did test the platform. Today we're using the webinar format of Zoom. And so we've asked members of the media to just indicate by the raise hand feature that they have a question, and then we will put them over onto the platform so that they would be able to turn their cameras and microphones on and then ask questions. So they've been fully apprised of that. And so Janet Silvera is our first member of the media who has a question, and there are several. And so, sir, let's go to Ms. Janet Silvera. Janet, good evening.
Good evening. My question is, I'm seeking clarity on what variant is dominant in Jamaica. What is the efficacy of the procured vaccine against this variant? How often is the government submitting samples for viral sequencing and variant tracking to advise vaccine strategy and protection of Jamaicans?
Good questions, and obviously I can't answer those questions, and I see the Minister of Health turning to the CMO. So CMO.
With respect to the testing results, I think that's one of the main things that persons want to know, if we have gotten back the test results so far for the 114 samples that we have sent. No, we have not gotten those back as yet. In terms of what variant is most common in Jamaica, well, we would have known that we would have tested for the UK variant when we had that set of arrivals from the UK, and we would have had 4 positive persons. We have not received any other test results so far. However, I want to say that, you know, regardless of what variant we have in country, that the precautions remain the same. In terms of effectiveness of the AstraZeneca vaccine that we will be getting this week and probably next week as well, the vaccine has been found to be effective against all COVID except for the effectiveness against the South African variant, where there was decreased efficacy in that set of persons. In terms of prevalence of South African variant in Jamaica, we would need to get back some results to be able to determine if there is a presence of that variant here. The first set of results that we had reported on, those were all negative for the South African variant. So it was tested for, they were all negative, but we await other results to see if there's any evidence of that here. So that's the only one we would have concern about, and right now we have nothing to suggest that it is here.
Thank you so much, CMO, and the Prime Minister will return to the lectern. In the meantime, then let's get Ms. Brittany Clark from Nationwide News Network on.
All right, good evening, everyone. Are you hearing me clearly?
Ms. Brittany Clark from Nationwide News Network.
Hi, good evening. Are you hearing me clearly?
Perfectly, Brittany.
Okay, great. All right, so Prime Minister Holness, I understand the decision being made with regards to funerals and burials. However, will an appeal be made on behalf of the citizens of Jamaica to the owners of morgues and funeral parlors to consider waiving or reducing the storage fees for bodies until those measures are lifted?
As I said, Brittany, we spent more than an hour discussing this issue, and we took the decision to do it knowing that there could be some exploitation of the situation. I agree with you. The appeal is going to be made. The Minister of Local Government will have more to say on it, but I'll ask him to just come now and say a few words on that.
Thank you, Prime Minister. We have issued invitation to meet with the Undertakers Association to discuss the matter. We intend to meet with them this week to engage them in discussions around reducing the cost or waiving for the period. We know some are going to say it's difficult, but we are prepared to engage them in extensive discussion over the next couple of days on this matter.
Thank you, Minister. We were in this position once before, my recollection, Minister Mackenzie, just before we did the lockdown in St. Catherine.
Thank you so much, Prime Minister. Let's then go to Ms. Dion Jackson-Miller from the RJR Gleaner Group. Dion, good evening. Dion?
Thank you so much, Naomi. Okay, first of all, I heard what the Health Minister said. I'm still asking, however, for a detailed distribution plan for the vaccine. In other words, further information in relation to the distribution within the categories that he mentioned, who is getting before whom, and then when those persons are finished, who is next and what's the justification. Can we please get a detailed breakdown of the vaccine distribution plan now? That's one. Number two, I'm asking about the MOU with the private sector organization. I'm not clear on this. Is it that the private sector funds are pooling with the government funds to create a general pool, and that the priority table still applies regardless, or is this going to be a way for rich people to jump the queue? And three, hospitals have been struggling for weeks. So we hear the government now saying they're implementing their surge plan. We knew the surge was coming, and we heard about some of these plans from last year. Why is it that the government waited until the hospitals were on the verge were full and had been full, as I said, in some cases for some weeks, before putting the additional capacity in place?
I'm going to invite the Minister to join me and answer. But I'd like to just quickly say that the issue of equity, social justice, and fairness in the distribution of vaccine stands quite high in the government's policy priority. And that directive has been given, and it is clear. We, by virtue of the principle of efficiency as well, we have looked to partnerships with the private sector. But there is no way in which the private sector partnership will trump the equity principle, meaning that though we partner with the private sector, it will not in any way interfere with the order of distribution for inoculation that has been set by virtue of the vulnerability list. And I want to make that absolutely clear. That is something that I know could create quite a bit of social dissonance in the society. There must be no question about anybody's social status giving them access to vaccines over persons who are vulnerable. The government is very sensitive towards that. Minister Tufton.
Thank you, Prime Minister. On the first question, which is the plan, as I said earlier, we unveiled a very comprehensive plan to the Cabinet yesterday, which was accepted. And there are several components to the plan, so it would take some time to go through that process this evening, which is why I ended my contribution earlier by saying on Thursday of this week, during our regular COVID conversations, which is aired, obviously you're normally on that, Dion, we will unveil with charts and diagrams and explanations all the elements of the plan, and will provide you with any responses that may come up, any questions that are asked. So I reassure you that the plan is in place. The Cabinet likes the plan and have signed off on the plan, and the plan will be unveiled for all to see. But the elements of it, which we have said, the priority groups, the distribution centers, the training, the inventory management, the cold storage management, the logistics. We have syringes in stock. I went and saw them for myself at the warehouse, the cold storage rooms, the mobile cold storage igloos that are in place, and I could go on and on and on. So on Thursday, please bear with us and we'll give you the details of that. On the issue of the PSOJ's MOU, the Prime Minister, I think, has made it quite clear. It's impatient of further debate or discussion. The MOU sought only to bring the critical stakeholders within the society through partnership to address what is a national crisis. Remember now, all of us are at stake. All of us are at risk. And we in public health, as is the case with the government, have preached and beseeched the need for partnership. So all the private sector has done is said, listen, where can we help? And we are committing to collaborate with you. As it relates to vaccines, they have said they are prepared to put up resources. Now, the global vaccine politics, if you will, is now dictated by governments negotiating, not private sector entities, as Minister Johnson Smith may have said earlier. So any conversation around procuring vaccines has to go through governments working through bilateral or multilateral arrangements. And the private sector, therefore, will be coordinated by the public space. So I reassure you that that MOU will not in any way cause anyone to jump the queue. And I believe in the sincerity of those we are dealing with in the private sector, that they are about trying to do what is good for Jamaica, because ultimately it's all about everyone, whether you're in the private or public space. We did commit to making the MOU public. I'm not sure if it was, but if it's the representative of the private sector, Mr. Zaka, was asked to appear before the Joint Special Select Committee of Parliament dealing with COVID matters. And he will appear at the next meeting, which I believe is this week, if not this week, the next week. And the opposition will, and all of us will be able to ask questions and for him to elaborate on any issues around the MOU. But he was designated the spokesperson for the private sector. And so more will be said on that. And then finally, on the issue of Why so long? It really, to my mind, we did not start planning when the surge occurred. In fact, if you look back at when we started to construct the additional wards, we started to construct back in October, I think, October of last year, when we were well within, we were managing. We had significant excess capacity, as a matter of fact. We were slated to complete that process in December, but then we had about 3 or 4 weeks of rain, which pushed back the dates until January into February. And then converting regular wards to COVID wards was always a possibility, but it was decided not to do so until you needed it. So it's not fair or accurate to say that we were not prepared. We have always been prepared, but some of these things are about timing, and we did it at the right time, I believe. That is not to say that Jamaicans should not be careful, because there's not enough capacity for irresponsible behavior, and I think that is a critical message that we need to push. Thank you.
Thank you, Minister Tufton. Prime Minister.
Before you go on, I really must commend the Ministry of Health team. I remember the very first meeting of the Disaster Risk Management Committee when we received the presentation about how the pandemic will unfold and what the capacity would be. You are almost right on target with the number of beds that you would need. You said we started planning from October. You started implementing the plan in October. We started planning from day one. We started the negotiations to get the field hospitals here, to acquire the additional stock. Minister Clark, who is online, made the provisions, the fiscal arrangements for that. All of those things are in place. A hospital ward doesn't happen overnight. It doesn't happen in 3 weeks. It takes months to plan. And I have to emphasize this, because sometimes the narrative and the conversation is that the government is flat-footed. We have been managing this pandemic in textbook fashion so that we are able to respond in time as needed. As Minister Tufton pointed out, what would have been the benefit if we were to move regular hospital beds into COVID beds and we didn't need them? And we have to elevate the conversation around it, because it does give a false narrative about how we are managing, and it doesn't help. The reality is that the Ministry of Health and the entire government has been working in a very strategic way. We've been managing fairly well. There are challenges. Of course, there are areas in which we can do better, but I think sometimes the narrative is just unfair and indeed sometimes false.
Thank you so much, sir. We do have just a few questions from members of the public who seek clarification. I'll try to infuse those along with those from the members of the media. If you'll oblige me, please, members of the media. There is one in particular that comes from Dr. Eldemaya Shearer, who also deals a lot with the elderly. And she's asking, especially coming from a frontline worker, a health worker, who's asking, can they leave home to do their work being a frontline worker? I suspect this is maybe a nurse or a doctor.
So that's a tricky one that I would want the CMO to answer, because it is specifically to a frontline worker, maybe someone who is a medical doctor, 60 and over. Yes. The CMO I'll ask to answer that. But in general, the order allows for a person who is 60 and over to be able to leave their home once per day to deal with the necessities of life, and then we made a further amendment to allow them to go and oversee their business. For medical personnel, I'll ask the CMO to come and give her interpretation of how that order should be effected.
Thank you, Prime Minister. So medical professionals, doctors, nurses, other healthcare workers, are in fact essential workers that are exempt from the work from home and stay at home orders. We know that your service is required, And we also know that you know how to act responsibly, to use your personal protective equipment to safeguard yourself and the rest of the population.
Thank you so much, CMO. Let's go back to members of the media. Ms. Kate Chappell, who is a freelance writer and she writes for Reuters, is next. Ms. Chappell?
Yes, good evening. I would like to ask more about the 1.8 million vaccines. Can you say again where they're coming from, when they'll arrive, and what exactly the rollout process will look like? Thank you.
I'll invite Minister Tufton or Minister Johnson-Smith. Minister Tufton, you will come and explain.
Right, so we did say that by April of this year, 2021, we should begin to see the arrival of the, in part or otherwise, of the 1.8 million doses of the vaccines from the African platform. I don't have a lot more to say. It will be part of the pool of vaccines that we will receive. The application will be similar to the plan. Priority groups first, so depending on where we are in that plan, depending on whether we get additional amounts from COVAX, then it will determine exactly where or who will benefit from the vaccines. I don't think there's much more to add to that. Minister Johnson-Smith, I don't know if you want to add anything else, no? That's pretty much it. Thank you.
All right, since we have several on the Zoom platform, let me then go to the President.
Just to be clear, so the rollout would be, we have 50,000 already defined to come, plus an additional amount, which I won't say how much that is yet, but it could bring us close to 80,000 within a week's time. Then after that, there are arrangements made with other private commercial opportunities that could bring in, I hate to give numbers, but yes, we won't give numbers because, again, those are still under negotiation. But for the African platform, we were scheduled to get 250, but as the Minister explained, there were some circumstances changed, plus our lobbying and negotiations. That amount could possibly double. And then outside of that, in going April, May, there are some other commercial arrangements which will come on board as well. And that is the kind of rollout of the numbers that we will get. Effectively, what we're saying is that we should be able to start vaccines, and while we are vaccinating, we are getting supplies in just in time so that we will be able to seamlessly carry through a vaccination program for the next 6 months or so.
Thank you for that explanation, Prime Minister. There are many more questions on the Zoom platform. Let's quickly then go to Mr. George Davis, the second-term president of the Press Association of Jamaica. George, good evening.
Good evening, Naomi. Good evening, Prime Minister. I'd like to ask, I think I'm upside down. Let's see if we can fix that.
Okay, Mr. Davis.
Right. Good. Sorry. Yeah, I'd like to ask this question of the Minister of Local Government, specifically as it regards to the National Premier League, the new season for which the sponsors, well, the organizers have been doing good work to marshal funds for sponsorship. They're almost at their quota. The clubs have been ready, standing down, ready, standing down, ready, standing down. Can you say definitively, with the set of circumstances the government is dealing with at this time, what should organizers expect? Will they get the green light? Must they wait, especially given that the window is closing, World Cup qualifiers begin soon, and there's no local football? I'd like him to address that today. Thanks.
Well, all I can say for now is that the matter will be reviewed and looked at to look at what is possible. I want everyone to understand and appreciate the circumstances under which we are operating now. And we will take it based on the discussions that we'll be having over the next couple of days involving the Minister of Sports, and the Ministry of Health on this matter. But I want to make the point that we did, in fact, made allowances for the resumption of training earlier on. So we'll have to revisit based on the existing circumstances.
I just wanted to say quickly on sports. Recently there was an issue about how the orders were administered. And it raised the favoritism, equity issues. We look very carefully at it. We would like to see the resumption of sporting activities, no doubt, but we want to see it done safely. What we're observing is that the various sporting associations, they are coming on board with plans and they're working on it. But right at this point in time, it would be inconsistent with the challenges that we face if we were to give approval. So whilst we are not closing the window on sports, but just within this period until we get a leveling off of the threat, we would not be able to give approvals. So we would still consider them, still work with them to ensure that we refine the arrangements. And then as soon as we are out of this danger zone, we can start to look at how we can get the sporting sector back up and running. And I want to thank the sporting sector for their patience and understanding. I know it's not easy. It's an industry, it's a business, and many of them earn their income from it, and they haven't been able to earn any income. So bear with us until we go through this rough spot.
Thank you, Prime Minister. Thank you, Minister Mackenzie. Prime Minister, we have so many people in the diaspora who are also watching and listening to the measures that were announced. One question coming from the diaspora: what obtains for persons who have received the vaccination and wish to travel to Jamaica?
Again, I'll ask the CMO to address that.
So we have been getting a lot of questions where this is concerned, and I just want to mention that right now, when we have not started vaccination amongst our population, and even when we start, we would not get up to a certain number of persons being vaccinated. The vaccination that is done by the individual coming in protects them. We really want to look at measures that protect our population. And so, therefore, quarantine measures still remain in force. We have not changed these as yet. Right across the region, there has been no change in quarantine measures. Persons still have to come, when they're coming in, regardless of having completed their vaccination, they still require quarantine.
Very important point, CMO. The vaccination doesn't mean that the virus isn't still circulating. It just means that you won't get sick from it, but somebody else could.
Thank you, Prime Minister. Thank you, CMO. Let's go to Ms. Zara Burton from 18 Degrees North. Ms. Burton?
Hi, I hope you can hear me. I'm on my phone today. Good afternoon or good evening, everybody. As of March 4, this one is coming from Twitter that somebody asked me to ask. As of March 4th, the GOJ requires its citizens to submit their COVID results at least 72 hours prior to departure. What if you've tested positive but are not able to quarantine the country where you've received the test? Will they be accommodated? And also, is it a PCR or antigen test that you need to take 72 hours prior to coming in? But my questions are, in addition to those, please, this is data breach related. What's going to happen now with all the data that was stored? Has it been destroyed? Will it be destroyed? And if it's not yet destroyed, when will it be destroyed? Question 2, has the government as yet been sued by anybody for the data breach? And then question 3, last one, in terms of the arrangements for India, and I know the Amsterdam was mentioned with AstraZeneca. I think in the past we had to sign an indemnity agreement with AstraZeneca. Just wondering, which, and the African Medical Supply Platform as well. So which countries and which companies have we had to sign indemnity agreements with so far?
All right, I'm going to ask the Minister of Health or the CMO to address your questions on
Okay, in terms of the Jamaicans that are returning home, in the past we have not required Jamaicans to have a test coming home because we certainly don't want to have a barrier for persons coming in country. However, for their requiring a test now, there will be an issue of will they be able to board the airline. Certainly, if they are allowed to board and they come in with a positive test, it certainly gives us a heads up in terms of quarantine and isolation that needs to be put in place. So if a Jamaican returns home and has a positive test, then the health authorities will take it from there. So that knowledge is important for us to put in place actions that will safeguard the population. The question is whether or not they will be able to come to board the plane to come in. And we will, I think every Jamaican will have to see how we proceed. Right now, we're trying to put in measures to safeguard the population as much as we can, and some of those kinks and different details will have to be worked out as they come along. In terms of the indemnity agreement, we have signed, we are in the process of signing the indemnity agreement with AstraZeneca. We have signed it already for AstraZeneca. That's the only one so far.
As it relates to the situation with vulnerabilities of the Jam COVID site, you will recall in previous press conferences we gave assurances that all data relating to tracking and geofencing, that those would be immediately destroyed upon the ending of the quarantine process for geofencing. My understanding is that is done currently now. Any other data would still be necessary for the management of the pandemic, certainly for statistical purposes. And as soon as we don't need it anymore, meaning the pandemic is over, the individual data points will be destroyed. We have not had any notification of any suits.
Thank you, Prime Minister. I recognize two new persons who are asking questions, and I believe Ms. Brittany Clark and Ms. Jackson Miller have indicated they want a follow-up, and we're trying to wrap up by 7:30. So let's then go to Mr. Jovan Johnson from the Gleaner, who has a question. Jovan? Jovan, are you on?
Yes, Naomi, are you hearing me?
Yes, we're hearing you well, thank you.
Great, great. Thanks, Naomi. Good evening, Prime Minister, and to the team. Prime Minister, two questions. Was there a contract between the Amber Group and the Jamaican government? And will you release the document? That is the contract, if there's one, for public scrutiny. And as we're on the issue of contract, you would perhaps see today the news in the Gleaner that the Office of the Services Commission denied a request for the contracts for the tax and police commissioners. What does it say, PM, that the public can't see the terms of engagement for the person who collects their taxes or protects them? In other words, do you think the contracts should be released?
You know, Jovan, we went through this issue of the privacy of contracts in Parliament. It was not a good experience for me, I must tell you, when we did it regarding some other issues. But there is such a thing in law about the privacy of contracts. As to whether or not the public has the overarching right to know, my personal view is yes, the public has the overarching right to know. How do they get to that right? It is obviously a legal issue. What legal hurdles do we have to clear to get there? I am not the legal person. The Attorney General, I believe, is on the link. And what I would do is ask her at an appropriate time to explain that. So we do have access to information legislation, which sets out the steps by which these information can be made available, and which sets obviously timelines on which information can be held, if so necessary, from the public. So my answer to you is yes, I think there should be, the public should know, but can it be just done by turning it over? Are there legal issues, legal hurdles that we have to cross? Sometimes I suspect that that may be the case. And as long as we follow the process, definitely the information should be shared. And the same would apply for whatever contracts that there are with any group that the government contracts services from, that they should be made available, unless, of course, there is any caveat for national security or any other sensitive reasons, such as bilateral information or sensitive trade and commercial information. So that would be my answer to you, Jovan.
Thank you, sir. Sir, I have two quick questions from members of the public, especially the commuting public, and one from a student. So let me just go to the student first and then to the commuting public. Will medical science students be considered for vaccinations, being that they're also on clinical rotations? And from the commuting public, a number of persons are asking, where is the monitoring for public transport within these current measures that you are also announcing?
For public transport, the Minister of Transportation, we had that discussion last night, and measures will be put in place to ensure that the JUTC, for which we have direct control over, that the various protocols in place, that those will be followed. In terms of the general transport sector, we will certainly engage them to ensure that they are following the protocols. The Minister of Health has nodded to me, or will you explain, has nodded that medical students who are on rotation, they would be considered part of the frontline army of health workers, and so they would become entitled to the vaccine.
And they're expressing thanks. How could I forget this one for parents who are who have preschoolers? They're asking if nurseries are also included in our orders.
Sorry, nurseries are included in
the face-to-face, no face-to-face contact. Nurseries.
Nurseries. My nurseries, remind me, nurseries are kept open, but remember now, the nurseries have a very strict and stringent set of protocols, and indeed it is so strict that some of them have complained that it's very expensive to put it in place, but necessary. But we have kept them open. We have considered them essential, especially for those persons who have to go to work in this new regime.
Thank you so much, sir. Then now let's go to, as we approach 7:30, let's then go to two follow-ups, beginning with Mrs. Jackson Miller, who has indicated, and then Ms. Brittany Clark, and we close out. Mrs. Jackson Miller. Dion?
Thank you so much, Naomi. The reason there is a delay, Naomi, is because we have to wait until we get into the Zoom meeting. Yeah, a couple of follow-ups. One of the most, one of the issues of most public interest at this time, given the prevailing circumstances, is a vaccine distribution plan. And I hear that we're essentially being told to wait until you're ready to release it, which is Thursday. But there really has been plenty of time in this press conference to give us that, which would have been new information. Can I ask why it wasn't thought imperative to share that information with the country at the earliest possible date? Second follow-up, I heard your response to me, Mr. Prime Minister, that you believe the government has been managing well. Healthcare workers all across the island who cannot speak publicly and therefore cannot voice their views on that have been contacting me over the past weeks, expressing their own frustration and anger with what has been happening in the hospitals. Do you think there's a danger, Mr. Prime Minister, that you and perhaps the Cabinet and the Minister of Health are not getting accurate on-the-ground information because you're in a bubble and you're not hearing what the people on the front line are saying? And finally, in relation to the work from home being encouraged by the private sector. Can you tell us why you wouldn't have mandated this for the private sector with obviously allowances for those people who have to be in office, given the fact that we're getting so many complaints about private sector employers who are refusing to allow their employees to work from home? Thank you.
Thank you for those questions, Dion. Let's start with the work from home. The government has obviously far greater control directly, administratively, over the public sector. And that is how we have done it in the first time we did it. We mandated it for the public sector, and we gave basically guidance to the private sector, and it worked very well. We then modified the guidance with a mandate that if an employee requests to work from home under certain circumstances, and they can show, proof that they have an illness, they have a comorbidity, or they have to take care of someone who is not able to function without them at home, then they should be allowed to work from home. So I think as it is, this measure works, and the private sector has been leaning forward. They have not been resisting. In fact, many of them, since we have introduced the work from home, they have been working from home. And what we are saying now, the mandate, is that they should re-examine their business processes, determine what is mission critical, and everybody else, as far as they can afford to, they should work from home. Bear in mind that there is a cost for working from home. You may have to provide your employees with devices. You may have to purchase a plan for them. So the government can't just unilaterally mandate that without thinking of those costs. So it is the spirit of cooperation that the government is ensuring that that is happening. The question regarding the receipt of information, and we are in a bubble. Let me just be clear. My ears is always to the ground in this country. I don't exist in any bubble. I get information from all sources. We hear the situation in the health sector. We understand it. We have allocated in our budgets the largest allocations towards managing the pandemic. Massive allocations. We know that even with those large allocations, it is still not enough. The health sector has been underfunded for decades. It is literally a miracle. It is down to the hard work and commitment of those healthcare workers why we have been able to respond. But we also hear the cries of the persons who have lost their jobs, business people whose businesses are going to collapse, all the other complaints in the society, and we have to balance them. The government could have taken a position, that we just lock down the country and maintain a 50 or 30% capacity in the health sector. The question then comes, how do we pay for the health sector? We cannot have a unidimensional conversation about the management of COVID-19 pandemic. It has to be a complete consideration about keeping Jamaica open, about keeping production going, about keeping people safe, about maintaining equity and social justice in the country, about maintaining law and order, about maintaining our infrastructure, about keeping people employed. And if you look at all of those things and the operations of the government across all sectors, you can only come to one conclusion. I urge the Jamaican people, in this time of pandemic, let us not divide for divide's sake. Governments must be criticized. If we are not doing well, you should tell us. But we must not persist with a false and unfair narrative. It doesn't do us justice. There's no benefit for anyone for that.
Prime Minister, then, our final question to Ms. Brittany Clark, who has a follow-up from Nationwide News Network. Brittany?
In relation to the vaccines,
I beg your pardon,
Minister
yes.
Tufton, in relation to the vaccines, you have presented to Cabinet yesterday a very impressive plan. I described it as being granular. There were some questions asked about even further details in the whole logistics. I ask you to present tomorrow as early as possible, publish it online, make it available. We are not keeping any secrets from the Jamaican people. This is the Jamaican people's business. As quickly as possible, present it to the public.
Brittany, your time, and also Prime Minister, yes, the Cabinet met yesterday on a Saturday, and the regular Cabinet meeting will also take place tomorrow. Monday morning, bright and early. Brittany.
All right, thank you, Naomi. Okay, so Prime Minister Holness, we hear your appeal to the moral suasion of citizens to comply with the measures, but what we see is that each time these measures are adjusted, the citizens, they lack compliance or they get more creative in finding ways to go around it. So how far is the government now with implementing plans or just moving along the process to make a law or even to bring out more stringent measures such as the ticketing system for persons in breach? And just a follow-up to my previous question on funerals and burials, just for some clarification, why wasn't a decision then made to also ban weddings rather than just reduce the number by 50%? Thank you.
Well, let's start with the last question first. My review of the statistics show that we probably have more funerals than weddings, and that the numbers at funerals would far exceed the numbers at weddings. So weddings present a much reduced risk. And of course, we would always want to promote marriage in the country. So having said that, Brittany, remind me of your first question.
So we're just saying that you continue to rely on the moral suasion of persons. So is the government now moving ahead plans to create a law, with the Disaster Risk Management Act, or are you implementing the ticketing system? What are the plans for that?
So Brittany, again, just so that the country understands, you can divide the response into two. One arm of the response is enforcement. The other arm is voluntary compliance. It's very expensive to enforce, and enforcement will never be complete. You also have to bear in mind that it is one force in enforcement. Right now, it is the JCF supported by the JDF. And that enforcement cuts across crime, border protection, cybersecurity, logistics and management of the health centers and the pandemic and all. In other words, people believe that it is just the frontline workers who manage the process. Sometimes when the frontline workers have to move, they need security. So enforcement should never be your first call in terms of applying measures. You must always have it there, but our first call is on getting the public to cooperate. My perspective is that we have far more reasonable Jamaicans than we have unreasonable Jamaicans. My perspective is that if we engage, if we provide information, if we are there being examples, and we provide leadership, that most Jamaicans will comply. and then that would reduce the number on whom we have to enforce. And that has always been the strategy. Jamaica is a liberal, democratic country, and that is how liberal democracies work. It is all about engaging the population, bringing them into the equation, bringing them into an understanding of the problem, enlisting them as positive actors, and the society moves together as one in this way. We only enforce on those persons who are deviant and deliberate in their deviance.
Thank you so much.
Ladies and gentlemen. Thanks for listening. And just last thing, I'd like to thank members of the diaspora and the private sector and just ordinary Jamaicans who have made it possible to give out almost 100,000 tablets so far. That many? We haven't reached that many yet, or are we? No, we have much more than that. I have given out myself close to 1,000 tablets. And I know right across Jamaica, outside of what we are doing in the government, members of the diaspora, average persons, are giving tablets. And that has really had an impact on the school system. And I want to thank and encourage Jamaicans to continue giving to the education sector. It certainly will improve our education delivery. Again, thank you, everyone. Good night.
Thank you so much, Prime Minister. That was Prime Minister, the Most Honourable Andrew Holness, giving an update to the nation. Just as a matter of clarification for those who are online, it is a matter that the Prime Minister just announced. As of March 8th, there will be no funerals nor burials. So there will be no funerals nor burials, and also online services only for churches. Only those who are critical to the streaming of services online will be allowed to deal with church services up to March 22. Thank you so much. We've had the Deputy Prime Minister, the Honourable Horace Chang, here with us today, along with several other ministers, Minister Mackenzie, Minister Tufton, Minister Williams, Minister Morgan, and of course the CMO and PS from the Ministry of Health and Wellness. Thank you so much for joining us. Please stay safe, and we'll see you again next time. Good night.